Thank you for taking the time to watch this companion video to our major blog post on Let's Make Informed Decisions Around School Opening. The goal of this video is to showcase the Scarsin COVID-19 decision support system that was driving the analysis in that blog. We have created an advanced modeling system for pandemics. In this case, we are focusing on the COVID-19 solution. It is national in scope, which is illustrated by the ability to drill down through the provinces and into the health regions. This is very important as accurate forecasts for COVID-19 should be done bottom up at the health region and board level. We are going to focus in on Health Region 2, which was a central focus in the school opening paper. A large Ontario health region with more than 1 million population. We are going to focus on the low Wave 2 scenario with schools open for this demo. The Scarsin model is an age living status compartmental ODE, or ALSCODE for short. The ODE stands for Ordinary Differential Equations, which is the math used in the algorithm. This represents a SEER-style approach to pandemic modeling. Scarsin enhanced this approach significantly by integrating broader real-world dynamics that interact in COVID-19 spread. So everyone in the health region fits into an age compartment as well as a living status. This graph shows the actual new reported cases based on their onset date in the blue columns, but we tend to look at it with a 7-day smoothing. You can see we have lots of other visualizations on case dynamics, hospitalizations, and deaths. Our solution has the ability to calibrate the algorithm to the health region data. You can see the methods at the top and also how the orange forecast line is fitted with the historical data. These groupings allow the forecaster to input assumptions about past behavior that are incorporated into the calibration process, as well as future assumptions to guide the forecast. There are three main themes: parameters about calibration and the virus itself based on peer-reviewed papers, non-pharmaceutical interventions or NPIs, which is our primary defense today, wearing masks, social distancing, and avoiding crowds where possible. This is primarily organized as by places where COVID spreads in combination with testing levels. Lastly, pharmaceutical interventions like vaccines and treatment. Let's focus on schools to showcase how this model can provide insights. We will start with a simple change to show how the model works and then complete a more relevant forecast about social distancing. Let's go to the schools section and start on the opening and closing inputs. The graph on the left represents the amount of reduction from pre-COVID behavior, which represents normal, or 0%. So when the schools closed in March, it had a 100% reduction in the school contacts. The graph on the right measures all of the NPI strategies together. So this forecast has about 40% reduction. Keep in mind that this focuses on a number of age groups with varying levels of behavior in schools. Let's enhance closing behavior to cover for the holiday and March break. We use the event table at the bottom to do this. Now we run the ALSCODE algorithm to update the forecast. You can see the impact on all reported cases in the region. Let's take a quick look at the other school inputs. Implementing the alternating 2- and 3-day week cycles in secondary school provides a 12% reduction in the total school contacts across all ages. Parents may also make the decision to opt out for online with their children. In this forecast, we utilized an initial 8% growing to 11% reduction. For masks with a maximum reduction of 20%, we have assumed a reasonably high compliance given the impact of younger children. The other NPI measures social distancing in the classroom, hallways, recess, entering or exiting the schools, along with cleaning and ventilation. This represents the biggest potential with a maximum reduction of 50%. The base forecast starts at 22, increasing to 29%. This assumes full elementary class sizes, minus the opt-out to online. Let's make a change in other NPI assumptions to evaluate increasing the benefits. We changed assumptions in another part of the model to identify a potential upside to 53% steady state. But doing that for September 8th isn't realistic, so we can change the opening at the same time. Let's go over and change that to September 22nd. We can now run the all-SCODE algorithm again to see the resulting changes. Remember that this is able to measure changes in spread across all compartments. So these changes not only impact children, they impact reducing spread in all age cohorts. It is also important to note that reported cases represent a minority of all of the cases in this health region. We can save these as a new forecast in the platform and move on to other analysis. Here is the web dashboard, which allows decision makers to view the results of the forecasts and gain insights. Let's move to the forecast comparison screen. Here we have the low and medium wave 2 forecasts. We will look at the medium as we already spent time on the low. As we compare the medium wave 2 with a September start versus keeping school closed, you can see that as the wave behavior grows from low to medium, the potential for the school to spread infection to the broad community grows as well. So opening schools is a serious decision. Thank you for taking the time to watch this.